Here's a patient who had clinical signs of portal hypertension, and so they ended up getting a liver Doppler ultrasound. Here we can see that they're measuring the portal vein here, and here you can see that the velocity is around 20 to 30 centimeters per second, and it's going in the forward direction, so towards the liver, so that would be appropriate. Right beside the portal vein is the hepatic artery, which you can see the hepatic arterial waveform here, which looks fairly normal. The anterior branch of the right portal vein is demonstrated going correct direction, and same thing with the posterior branch. The thing that was abnormal about this patient is if you look here, you can see that there's a flattened waveform here within the right hepatic vein, also within the mid hepatic vein and the left hepatic vein. And normally that these have the same kind of waveform as you would see in the inferior vena cava with the ASVD waveforms. And this one just looks fairly flat. And this can be from a couple different things. One of the things that we think about when you see a flattened appearing waveform is the liver coarse? Is there some kind of coarsened nature to the liver that when you're getting the backflow from the heart, it prevents us from being able to see the correct undulations of the normal ASVD waveforms, and it can appear flattened. So you can see this with severe cirrhosis, but you can also see it if you have failure of communication between the hepatic vein and the right heart. If that's narrowed or if there's some kind of obstruction in there, you can also see this as well. This patient went on to get an MRI, and let's take a look here at the portal venous phase on the MRI, and we can see here is the IVC coming here, and there's a little filling defect in here, a little web, and we can see that there's quite a lot of narrowing here with between the IVC and the hepatic veins. And so here you can see the hepatic veins without contrast within them, this kind of dominant right hepatic vein, but the middle and left hepatic veins are not really showing contrast within them, and it looks like there's pretty severe narrowing at the IVC. We can also note here that there's recanalization of the paraumbilical vein, and there's probably some shunts between the portal system and this patent right hepatic vein. And so, this patient also has splenomegaly, numerous collateral vessels. So this is actually a patient who has Budd-Chiari syndrome, and Budd-Chiari is occlusion or narrowing of the hepatic veins or the IVC, leading to a congested appearance of the liver. And so this is the reason why we're getting these flattened waveforms, is because there's not great communication. Even though this right hepatic vein is patent, you're not getting great communication between that and the right heart to be able to have the normal appearing waveforms.